our, let's see, I'm going to see what time it is. There we go. Our conversation today is about shared decision making, a tool that can be used in all aspects of mental health decision making, but we're going to talk a little more specifically about the use of shared decision making in medication management and how that can facilitate partnerships among youth, families, and clinicians. So I'm going to kind of go over what this is all about, and then Marjorie and I are going to talk a little bit about our personal experiences with shared decision making. There's really no single agreed upon definition of shared decision making, but there are a number of similar concepts that also lack consistent definitions, including empowerment engagement, person-centered care, self-directed care, or self-care management. The common theme being the issue that the person who is receiving the services has an element of control in the decision-making process, which enables their active engagement and often facilitates the effectiveness of the intervention. SAMHSA in 2011 tried to pull together what they thought was a diagnosis and described it as an interactive collaborative process between providers and consumers used to make healthcare decisions in which at least two individuals work together as partners with mutual expertise, both professional and experiential, to exchange information, clarify values with regard to options, and arrive at a discrete decision. So the key characteristics of shared decision-making are that there's at least two people involved acting as partners. Both are taking steps in sharing a treatment decision, and both share information about the treatment options and then arrive at a consensus regarding a preferred treatment option. So the process steps typically include starting with the recognition that a decision needs to be made, kind of important, identification of the partners in the process as equals, a statement of options that are equal, exchange of information on pros and cons of those options, exploring to make sure everybody's understanding fully what those are and the expectations, identifying preferences, negotiating options, gaining concordance, and finally sharing the decision. And then the last step is arranging to follow up to evaluate the outcome of that decision. How are we going to know whether that decision was the best decision or not going forward? The objectives are improved communication, understanding, and decision-making. And when shared decision-making is used effectively, more information about consumer preferences, practices, and values are elicited and taken into consideration. And that's a critical component, is that getting the individual's preferences and values really can result in much more significant engagement in the overall treatment process. Shared decision-making should result in decisions that are more appropriate for the individual consumer, will lead to increased satisfaction, and there's some early research suggesting that there is even better health outcomes as a result of shared decision-making. So, when it comes to medication management, oftentimes people think, well, how could shared decision-making be implemented in the process of medication management, because that's such a technical thing. But the truth of the matter is that using medication is an active process that involves rather complex decision-making and a chance to work through potential decisional conflicts. And it requires a partnership between two experts, the client and the practitioner. And in this, I'm quoting from Pat Deegan, who is a champion of shared decision-making, has done a lot of writing about it, and somebody who I admire, and so I often quote from her whenever I can. So, the way one frames shared decision-making used in a medication management setting is to think of the consumer as the expert on his or her current functioning and his or her unique response to medications, both effects and side effects. And the prescriber as the expert on effects, side effects, and the evidence base for use of medications. Both of those sets of expertise are essential to effective decision-making and conflict resolution. Often what I'll say to a patient or a family member is, sort of trying to frame this for them is, I can tell you what the percentage likelihood is that you'll get side effect A. Only you can tell me whether you actually get side effect A and how bad it is for you. And as anyone who's managed medication or been a part of a medication management process knows, you can have two patients walk into the room, one after the other, each with the exact same side effect, one of whom will say, I can put up with it, I'll deal with it, don't worry about it. And the other of whom will say, I can't take this medication for another day. It's just so horrible. And it's critically important for the prescriber to have that information and to be able to elicit it through the mutual respect of the shared decision-making structure. So, just like any other interactive process, people need to have certain characteristics in order for it to work most effectively. So the ideal prescriber is somebody who's confident in his or her knowledge of the evidence base regarding the use of psychotropic medication and is willing to accept and acknowledge the consumer's expertise, the unique impact of the medications on them, and the consumer's control over the process. We have to acknowledge our lack of control. You write a prescription and hand it to somebody. That doesn't mean they're going to take the medication. It doesn't even mean they're going to fill the prescription. So we, the prescribers, lose control the moment the person walks out of the room. And so this is one way of partnering to make sure that that works. Similarly, the ideal consumer is somebody who's confident in their ability to observe and communicate effects and side effects of the medication, and is willing to accept and acknowledge the prescriber's expertise as well. So what we're really talking about is some degree of mutual humility. That's that bottom bullet there. Each partner in this process acknowledging that there are some things they don't know and that they need to know from the other partner. And the tensions that develop are when that mutual humility is not present. If the prescriber is overconfident or lacking in confidence about their knowledge base, they may be very directive in their approach to medication treatment. I'm the doctor, I'm the nurse practitioner, I know what's best for you, this is what's best for you. Or they may be lacking in knowledge. I've seen some prescribers who are uncertain about prescribing and so will abdicate responsibility for their role in the process and will say, what do you want your child to be taking? Which is equally inappropriate. And obviously not being respectful of the family's expertise is a point where tension can develop as well. Similarly, the consumer's tensions can develop with the consumer when they're overconfident or lacking in confidence. The consumer who's overconfident is often the person who's gone home after the first appointment, has researched the medication on the internet for an hour or so, and comes back feeling like they know as much as the prescriber does and is ready to drive treatment. The flip side of that, though, is the consumer who sits back and passively says, you're the doctor, you tell me what to do. And so those are where some of those tensions develop. Common decisional conflicts with medication management, where shared decision-making can help, is the prescriber feeling like the medication's helping, but the consumer feeling like the medications are controlling them in some unpleasant manner. The prescriber feeling like the patient is back to baseline, but the consumer saying, I'm not myself, this isn't me. And the prescriber focused on symptoms, saying that your symptoms are under control. The consumer focused on side effects, complaining they're feeling drugged. And those are all elements that we run into on a regular basis and need to be resolved. Because if they're not, what often will happen is the person taking the medication will just quietly discontinue the medication without telling the prescriber, and then you've lost any ground you might have gained. It's worth noting that shared decision-making in child mental health adds some added complexities. There are 3 experts in the room. In that case, there's the provider, the family, and the youth. And the role of the youth varies depending on his or her developmental level. And if you've got a typically developing youth, that's a dynamic changing role for the youth over time. Oftentimes, if I start working with a family and the child is school age or early school age, the structure of shared decision-making is myself and the parent partnering around the decision-making with the child as a consultant to that process. And then over time, if I have the luxury of working with the child over time as they go through their development, that the roles change. and we get to the point of the child, the partnership being between the prescriber and the youth, with the parent as consultant. And that's another one of the advantages of shared decision making, is if you're really engaging in and sensitive to that developmental process, you are basically effectively preparing the child to be an effective, empowered consumer of adult mental health services when they walk out of the child mental health environment. So that's the, the basics of it, and we can talk a little bit about our experiential pieces of it.
Yeah, so as I said, my name is Marjorie, and I'm the parent of an adult child. My son is 20, and he was Dr. Jewell's patient from the age of 8 until the age of 18. And so we had 2 other prescribers prior to Dr. Jewell that did not use the process of shared decision making. So when we got to Dr. Jewell and suddenly we felt empowered in the process, I felt like I was being heard for the first time in a long time. And he didn't seem to, mind if I questioned him about why this medicine, or what about this side effect, or he was partnering with us. He was really kind of bringing it into this collaboration. And I didn't know such a thing existed for medication management, but I was welcoming it full on. It was just such a welcome change to what I had experienced and what I needed for my son. No mom wants to put their 8-year-old kid on medicine and then not feel heard about it. So having Dr. Jewell recognize my expertise as my son's parent was phenomenal. It was so phenomenal to be part of that process. So Alex also felt that way. I don't know that he maybe noticed it so much when he was 8 or 9 or 10, but certainly by the time he was in middle school and high school, he appreciated, being consulted, being listened to. He knew when we came into that office that we were going to be heard. And we didn't have what a lot of other parents share with me, anxiety about going to the office or not wanting to go. We couldn't wait to go see Dr. Jewell because we knew there was going to be no judgment. We were going to be part of the process. And it was important because at the time, my son was diagnosed at age 6, and I had joined a support group, and many of the parents shared their frustration over their kid not wanting to take medicine, or their kid as a middle school or high school, or saying, I'm not going to take it anymore, or when I turn 18, I'm not taking my medicine anymore. And I thought, I can't be in that situation. That's not good for my son. That's not going to be good for our family life. So how am I going to prevent this from happening? And so that was always in the back of my mind. And then we found Dr. Jewell, and I thought, oh, this is how you prevent that from happening. You empower the youth. So, I want to share with you maybe exactly what it looked like. So, we walk in the office and we sit down, and Dr. Jewell would say, how is it going? And I would share from my perspective how it was going. Alex would share, or sometimes not so much share, how things were going from his perspective. And I might have to prompt him or fill in some spots. And, Dr. Jewell would share his thoughts on what was happening. And, maybe I would say, I think he's, I see symptoms of depression, and I think we need to add some medicine or up a dose or something. And Alex might say, no, I'm just having a bad week, or I'm just having a bad day. I don't think that's what's happening. And, my anxiety would get a little high, thinking, no, that's exactly what's happening. And we're going to go home, and in a week or two, we're going to have meltdowns, and we're not going to be in a good place. And we need to be proactive here and really kind of address this. And I learned that, no, we had to listen to Alex. So if he said, no, I'm having a bad day or a bad couple days or a bad week, then Dr. Jewell would help us figure out what would it look like if it was more than just having a bad week? At what point, would you consider upping your dose of your medicine? And so we would, outline what that looked like. And there were times that, we would say, if a week from now I'm still feeling this way, or, 2 weeks from now I'm still feeling this way, I would consider it. And there were times that Alex would wake up knowing this is the day, and he would say to me, Mom, you need to call Dr. Jewell today. I need to go ahead and do that. Or there would be days that he would say, I'm feeling good, and I think I'm moving through this now, and I don't need anything. And it was empowering him like that. It really made him part of the process and part of the solution. So we didn't often have him saying, I'm not going to take my medicine, but he's not an angel, even though he's my angel. So there were times that he would engage in a power struggle. Usually it was when he was upset with me. So then the power struggle would be, well, I'm not taking my medicine tonight. And I knew that this was a power struggle and this wasn't about the medicine, but I needed to empower him. So I would say, okay, if you don't want to take your medicine, that's fine. I can call Dr. Jewell tomorrow and let him know you don't want to take it. Not as a threat. It wasn't I'm going to call and tattle on you. It was, and then we'll, find out what do we need to do to safely take you off the medicine so that you don't have any side effects or, any withdrawal or whatever might happen depending on what medicine you're on. And it removed the power struggle. He would usually find something else to have a power struggle with me about, but it wasn't about the medicine. So he would take his medicine. Maybe not in that moment, and maybe not a half an hour later, and he might stay up an extra hour and then finally take it. But it just wasn't an issue because he knew he would be heard. And at the same time, he is still a typical kid in so many ways. And when he hit high school, he said, I don't want to be on medicine. But he knew by this point that we would just get with Dr. Jewell. We would talk about, slowly taking him off the medicine in a way that's safe, that we can control it, that we can watch for any symptoms or side effects and address them as they come up. So that's what we did. And I think we spent a year or a little over a year kind of taking him off of the meds. And there were a couple times that we would lower a dose and he would start having symptoms and he would say, nope, this probably isn't good right now. And we'd put him back up to that other dose. And then we'd stay there for a while till he kind of evened out. And then when the three of us thought we were ready for the next decrease, we would move forward with the next. And I'm happy to say that, my son is 20 and he has been off of medication for several years now. I think he has substituted some of it with some really intense physical workouts and things of that nature to help keep his depression in check. But he's doing remarkable. And I think that he has a strong foundation to know that if he started experiencing symptoms where he wanted to be on medicine, he could search out a doctor who believed in the process of shared decision-making. I don't know how many of them there are out there for adults, and he could talk to someone about this and he could be he could partner with them and he could collaborate and they could work together to address it. And I think it's removed some of the stigma for him about, being on medicine or having to go see a doctor. Like I said, we for the most part, we really enjoyed going to see Dr. Jewell and we kept all of our appointments. I mean, occasionally we would have an issue, but it made the relationship between the family and the prescriber so much stronger. I think Dr. Jewell could say that he would know that when we left there, if we had a prescription in our hand, we were going to go fill it and we were going to take it as it was prescribed. We were going to report back to him. And we were going to do that because we knew he was going to listen to us. We knew that without a doubt that he would listen to what we said. And there were times we tried medicine that, I didn't often wait till a month later. I would sometimes call him at the 2 or 3 week mark that he said, this is where we should know where we're at, and say, this is not working. Or we're having a side effect and we're not willing to deal with this side effect and we need to make a change. And it was really, really an awesome experience as a parent. And I also want to share that as an advocate that I have worked with families. And just last week I had a mom call me about her first appointment with a new prescriber. And she was all excited. And she was telling me about how this person was listening to her and it seemed to be going really well. And she was really excited about it. And then it came time to talk about, we probably need to do a med change. And the doctor wanted to increase a particular med that this mom did not want to increase. and the mom said something, and the doctor listened and asked clarifying questions, and together they explored all the options, and the prescriber agreed with mom that, yeah, let's try a different med first and let's see, and we'll just continue to monitor. And the mom was so excited. I mean, she had a smile on her face telling me about the whole conversation. She couldn't wait to go back and see the doctor. She was excited to try the med. She was excited to be recognized as the expert on her child. She was excited to be heard. She was excited to be part of the process. And I often, when I'm sharing stories about our journey, I say, parents can be part of the problem, or we can be part of the solution. And this is a way that allows us to be part of the solution. So that's my experience with shared decision making.